Pleased to introduce Dr. Blake Beehler. Again, he's one of our first-year movement disorders fellows, and he had his MD or his medical degree from Rush Medical College, excuse me, and also completed residency at Illinois Wesleyan University in neurology. He's also received several awards and scholarships during medical school and residency, including the Dean's Summer Research Scholarship. He's done both clinical and basic science research in Parkinson's, and we're really excited to have him here working with us. And so he'll talk to you about Brain Health 101.
Hello, everyone. Welcome. Thanks for coming. And we'll take a little bit of a kind of broad approach to overall brain health. There's a lot of information out there. Some of it probably a little bit misleading, so hopefully we can sort of look at a lot of different evidence that we've developed over the past few years and give you some action items that we can improve on today. Usually parsed out as about 30 to 45 minutes a day, 5 days a week. But really anything is good. And you really should be starting gradually and building up. We don't want everyone to leave from here and start training for a marathon immediately. Do something gradually, avoid injury, do something a little bit more attainable and set small goals to get you up to that higher level of exercise. And the types of exercise should really be an individual choice, and they should be enjoyable to you. It shouldn't be something that you dislike doing or avoid doing. We've had thousands of years as humans to come up with interesting ways to exercise and sports. So there's going to be one out there that is going to be enjoyable to you, I promise you. And things to think about are either like interval training, yoga, Pilates, doing sports like pickleball, tennis. All of those are getting out and active. Cross-country skiing in the winter when it's a little bit more difficult to get outside, and really utilizing some of the extra benefits we have out here in Colorado. And I frequently get asked about golf and its role in exercise, and I do think it's wonderful in getting outside and getting activity, but unless you're jogging from hole to hole, I don't know if it's really getting the cardiovascular benefits that we see with these other exercises. So I highly encourage you to continue the golf game and enjoy getting out in the social aspect of it, but I would reach elsewhere to get some of those cardiovascular benefits that we see in regular exercise. And an important aspect is try to incorporate interval training. So we've found that actually altering the intensity of the workout over the course of the workout is actually more beneficial than keeping the same levels of exercise. So an example of this would be walking briskly for about 3 minutes, or maybe the course of a song that you may be listening to, and then walking a little bit more slowly for the following 3 minutes. And if you repeat this sort of cycle 10 times, you've already reached your 30-minute activity goal for the day. And it's likely been more effective and efficient than staying just at the slower pace for that 30-minute time period. But most importantly, do what works for your body. If pain is a limiting factor, there's a lot of good evidence and research in considering swimming and water aerobics, which helps take off some of that strain on the joints, which is a big issue for people and can actually improve pain and arthritis when working with water activities, and also considering recumbent exercises like recumbent bicycles or stationary indoor exercise machines, which can help, again, relieve some of the stress on the joints. And then I just wanted to put this as its own slide and provide a little bit more emphasis in this. And exercise is truly the only intervention that we have that's proven to slow the progression of Parkinson's disease. We just had a wonderful talk by Dr. Olich about all the medications that have been developed over the years. We have tried to show that they have a benefit in slowing down disease progression, but all of those trials have pretty much failed. So the disease is neurodegenerative. It does continue to progress, but the best evidence we have is that exercise does indeed slow down that progression, which is why it's a very important aspect of the treatment of Parkinson's disease, and I think should be an integral part in pretty much everyone's treatment regimen. On top of the medications that we have, I think exercise needs to be just as important as some of those symptomatic treatments. Next, I'd like to spend a little bit of time talking about healthy diet. There's a lot of information out there about this. I will mainly focus on the MIND diet, which is the Mediterranean Dash Intervention for Neurodegenerative Delay. So I'm glad that they shortened it to the MIND diet. And what that is a combination of the Mediterranean diet and the DASH diet. And what the DASH diet is the dietary approaches to stop hypertension diet. So both the Mediterranean and the DASH diet are well established in the literature in prevention of cardiovascular disease, which is basically hypertension, heart attack, and strokes. So basically, neuroscientists sort of took a look at both of these diets and kind of combed and tried to see what are the neuroprotective effects of each of these diets and kind of combined them into one diet that we've seen a little bit more present in the literature in the past 10 years and continues to gain more evidence as being neuroprotective. And newer evidence is showing that it can slow cognitive decline and even prevent progression to dementia. And this is an important point here. In the research literature, we usually characterize normal cognition, mild cognitive impairment, and dementia. And that transition from mild cognitive impairment to dementia is when we start needing help with different tasks. So we're starting to lose a little bit more of our independence and needing a little bit more assistance with daily tasks. So the fact that we can actually prevent that transition from mild cognitive impairment where you're able to do things on your own, just maybe with a little bit of extra assistance and carefulness, to transitioning into requiring a little bit more dependence is a really important feature, and I think a really important aspect of this diet and how protective it is. So I won't spend too much time on the exact specifics of the diet because I don't think you're going to memorize this immediately, but there's a ton of information online about sort of the guidelines for it. I think a thing to point out is that it's not entirely a strict diet that may be good for some people and may be bad for others. But what the point of it is that you should be using these guidelines to develop something that works for you. There's a lot of kind of cultural components of diet, and using this sort of guideline allows you to sort of build meals that are culturally relevant and enjoyable for you to eat. And it's more of a set line of guidelines. And we'll talk a little bit more about the research behind this. But things to point out is that in general, we're maximizing whole grains, vegetables, leafy green vegetables are the largest components of this. You'll notice that the components on the good side, on the right or your left part of the screen there, are all with at least that number of servings. So ideally, we're getting more. And then on the bad side, or the side where we need to just be a little bit more conservative, we're trying to eat a little bit less of the pastry sweets, a little bit less of the red meats, which are beef, veal, lamb, mutton, pork, goat, and venison. And leaning a little bit more towards the non-red meats, which are the chicken, turkey, duck, and rabbits, but mainly focus on sort of plant-based foods. And then trying to eat less than 1 tablespoon of butter per day. And then another important feature that's likely carried over from the Mediterranean diet is the olive oil as primary cooking oil, which has a lot of cardiovascular benefits. So this is all stemming from a pretty pivotal trial from Rush University, which is where I did my medical training. And they showed that following several hundred patients over the course of 5 years, they found that patients who followed the diet more strictly, so we're meeting a lot more of those goals on the previous slide, at the end of the study period, we're actually testing cognitively 7.5 years younger than those who had a more difficult time or were not following the diet as strictly. So I think this really does highlight the neuroprotective effects of it and slowing down that cognitive degeneration that we see in normal aging and with additional disease states, with the emphasis on preventing that transition from needing more assistance with the diagnosis of dementia. But in general, we like to talk about striving to just eat mostly plant-based foods, having a natural diet, which is usually limiting processed foods. So that's avoiding things that come out of boxes or wrappers. I know there's a convenience factor to a lot of that and a cost factor for a lot of that. I think there's a big issue with a lot of food deserts in this nation, but just keeping an open mind about some of these things and trying to incorporate them slowly into your diet over time can go a long way. The other or next pillar that I'd like to talk about is mental stimulation. And this is just the importance of keeping the mind active. So many people have developed different things that can be enjoyable to people, and one is not going to work for another person. So finding something that is enjoyable and something that you can kind of continue to do and not much of a task for you. So you could consider adding brain teasers, crossword puzzles, reading. Writing is a great exercise. You can consider writing short stories, poems, or journaling. There's also Sudoku, card games, board games, bingo, and chess, which are all mentally stimulating. And another great idea is try to learn a new skill. That old phrase of old dog can't learn new tricks is a little bit old-fashioned, I think, and not entirely true. We found that in adulthood and old age, there's still a lot of learning potential, and the act of learning a new skill actually does develop new synapses in the brain and can help limit the degenerative changes that we see. So learning a new language, playing an instrument or picking up an instrument you maybe played before, trying a new hobby, can all be very beneficial for that mental stimulation component of brain health. And we all know that trying something new is hard, especially if we're talking about new skills. You're not going to be good at it immediately, and sometimes that's a little bit upsetting, but just accepting that it's a process of getting good and getting more used to some of these activities, and making it a part of the daily routine can kind of help this transition period, and allows you to kind of keep up with things over time rather than getting discouraged with new skills. Next, I'd like to spend a little bit of time talking about quality sleep. There's a lot of information about this, and this is a huge problem that we see in our clinic patients. So there's several sort of sleep hygiene techniques that we tend to promote. So we'll go over a few of those here. The first one is sleep only as much as you need to feel well rested. So this is the fact that if you're sleeping too much and still feeling tired, that means you're sleeping likely too much. There's an ideal timeline for your body, and more sleep doesn't always mean it's better for you. So tips are keeping a regular sleep schedule. So getting up at the same time every day, regardless of how well you slept the night before. This allows the body to get into a rhythm of going to bed and waking up, and over time will improve the quality of sleep you get during the nighttime. Having a pre-sleep routine can be very helpful. You'll notice that a lot of these tips are sort of getting the body and the mind to calm down and get it sort of prepped and ready to initiate sleep. So this can include taking a warm bath, having a light snack, reading a book, but ideally not doing any of this in bed, which I'll get into in a little bit. The bed is primarily for sleeping. We also want to avoid stimulating things in the afternoon or early afternoon. So usually after 2 or 3 o'clock, we should be avoiding caffeine, alcohol, or tobacco products. And we just talked about the importance of exercise, but trying to avoid exercising within 3 to 4 hours of bedtime. It releases a lot of endorphins and can really be activating. So that may inhibit the ability of the bodies to calm down for that timing of the sleep schedule. Additionally, this is something that I recently learned about when I was looking up this talk. Max Richter, who's a famous composer, actually has a very large interest in sleep, and he's created this album called Sleep, which is an 8-hour lullaby, which is based off of some of the workings of Bach, and it's actually meant to promote sleep and help get the body ready for sleep. So you can play this in the evening as you're getting ready for bed. There's also many other classical composers who just have nice and less stimulating rhythms. So this can be a nice sort of thing to play in the background and just get that body and mind ready for the time when you do get to bed, and may help get to sleep easier. There's also some foods that have been suggested to promote sleep. So I think a lot of people are aware of chamomile tea, and it's effective making people kind of sleepy and tired, getting ready for bed. But additionally, people have suggested that maybe tart cherries or eggs, or even asparagus, broccoli, or sunflower seeds may also have a benefit in promoting sleep. And something that I do want to take a little bit of time on is many over-the-counter sleep aids actually have a potential to worsen confusion and memory loss. So it's really important to take a look at what's actually in the medicines you're picking up from the pharmacy. Many of the Advil or Tylenol PM formulations or Unisom will have a component of Benadryl, or diphenhydramine is how they'll write it on the label. And this is actually an anticholinergic medicine. So it works on the acetylcholine system of the brain. And acetylcholine is very vital in the creation of new memories. And we find, particularly in the aging brain and patients who do have some cognitive impairment, we really want to avoid impacting that acetylcholine system. So avoiding the ones that have those active drug ingredients in them, looking for the more natural components such as melatonin, valerian, or L-threonine, which are more kind of amino acids and supplements that are naturally found in the body, are going to be a little bit more helpful and help you avoid some of those cognitive effects that we see with the use of chronic Benadryl or diphenhydramine use. But mainly, before we even get to the medications, we want to try these lifestyle modifications and use non-medication methods such as standardized sleep schedules, going to bed and waking up at the same time. There's also gaining evidence in bright light exposure therapy during the day and during the early afternoon, which I'll talk about on the next slide. And we also want to limit screen time and caffeine use after 3 p.m. And additionally, there's a fairly highly effective intervention that doctors can prescribe called cognitive behavioral therapy for insomnia, if insomnia truly is a difficult thing for you. And this is going through a lot of kind of mindfulness and getting the body ready for sleep. And again, is avoiding a lot of those medications or drugs that could have actually deleterious side effects. We also want to reduce unwanted noise and light in the bedroom. So either turning on a fan or getting a white noise machine, having blackout curtains. The main thing is getting the bedroom comfortable. So keeping it at a comfortable temperature for you, getting a comfy mattress or sheets can really sort of help promote the idea of sleep. And then an important thing with sleep hygiene is if you can't sleep in 10 to 20 minutes, try to get up and do something else. It means your body's not ready for sleep and we should do something else and allow the body time to get ready for that process. So ideally doing something quiet, not stimulating or even boring. And this could include something like reading or doing small like knitting or quilting. Ideally, we're not using TV, phones, or computers. So this is something that I think the technological advancement has actually made worse for a lot of people. The TVs, phones, and computers, a lot of them produce sort of the red spectrum of light, which is stimulating to the brain. Even if you're using those filters that are claimed there for sleep or blue light, TVs, phones, and computers are meant to keep your attention and meant to stimulate you. That's what Instagram wants to keep you scrolling, so you see all those different ads. So it's stimulating the brain and preventing that transition into the sleep process. So really trying to avoid use of TV, phones, and computers, especially if you're having a tough time getting to sleep. And then after a little bit of time, if you're starting to feel sleepy again, going back into bed and attempting to sleep again. But this process can be repeated multiple times throughout the night. And ideally, we're trying to decrease that time that you spend in bed and maximizing when you're in bed for being asleep. So it's actually spending less time in bed will help you sleep better for the time that you are in bed. We also want to avoid excessive napping. So naps should be brief, 40 to 60 minutes. If anything, they should be occurring in early afternoon and not too close to bedtime. And we should be avoiding it if we're not feeling refreshed afterwards. That's kind of the body telling us that it's not an effective way for us to get ready for sleep and maybe disruptive of our nighttime sleep regimens. We can also practice relaxation techniques, which can help with that time period of getting into bed and sleep onset. So relaxation meditation, there's a lot of guided videos on YouTube or on the internet that can help you sort of really mindfully relax each part of the body and go slowly from the toes to the head. And that can be really helpful for just overall relaxation and getting the mind ready for sleep. Deep breathing can also be highly effective with just taking 2 slow, deep breaths. And that really kind of resets the heart rate and gets the mind a little bit more ready for sleep. Other things are counting, such as sheep. This is likely where the colloquialism has come from, or thinking of very nice visual like pictures in your mind, like going to your happy place are also proven to be nice relaxation techniques. And I mentioned this on a previous slide, but light therapy is another non-medication intervention that we have found may be effective in sleep issues. These are available online from $30 to $60. What we're ideally looking for is something with 10,000 lux, which is the intensity of light. It shouldn't have UV properties. We don't want you getting a tan in the morning. And it should be starting gradually. So how this works is you're having a light, you just place it within 2 feet of you off to the side and turn it on. And it should be sort of like facing up towards the face at a 45-degree angle and just having it on for 10 minutes while you're doing your normal morning routine, whether that's getting ready in the bathroom or sitting down to eat breakfast and just having it on for 10 minutes. You could slowly increase that up to 60 minutes over time, and you could also incorporate an early afternoon session as well. And this is ideally thought to help with circadian rhythms and get you ready into a routine sleep cycle. And another important aspect is if there is the component of snoring, we know that sleep apnea is a huge epidemic in the United States. And all of these interventions that we've talked about so far are likely to be not going to be as effective if you're having periods of sleep where you're having apnea or lack of breathing because you're starving your brain from oxygen. So really, if there's a component of sleep apnea, we need to be getting that treated and tested as well on top of using some of these other techniques. Next pillar is stress management. So this is very closely tied with what we've already talked about with exercise, sleep, and healthy eating. And we can involve both like meditation and making sure that you're doing things daily that are enjoyable to you. There's a very good resource on UCLA's website called UCLA Mindful that goes through free modules in order to try meditation. It's not for everyone, but if you haven't tried it, you could consider trying to incorporate that into your daily routine. And then the last pillar I'd like to talk about is keeping an active social life. We've got a wonderful, great volunteer and patient advocacy groups here today. But really, there's so many opportunities to get out in the community and volunteer, which really helps develop those social connections that are helpful for the brain plasticity. We can join social groups, book clubs, Bible studies, workout classes, art classes. We can schedule meetings with family and friends, ideally face-to-face, but the video conferencing and the availability of connecting with people with the technology today has been really great. So choosing the FaceTime over the regular phone call. You can invite others into your solo activities, get out into public places such as movies, museums, or national parks. And there's also a good website, usaaging.org, which can show available resources in your area to get more involved. And that's my reference for the study from the Rush University. And thank you for your time.